Hello, Dr. Ghassan.
Hello. Hi.
Hi, how are you?
I'm okay.
Thank you so much for connecting with us, Dr. Ghassan.
Thank you. Thank you for inviting me.
So we have, just that you know, we have about 790 participants with us today, and who've all come to hear what you have to tell us about the situation in Gaza.
It's critical that those on the outside, Palestinian institutions working with Palestine, and those who believe in Palestine as an idea, start having the conversations that we are unable to have on the inside, which is what happens. That we need to understand that this is a different war than the wars Israel has waged on Gaza in the past, and actually even different than the war it waged on Lebanon in 1982. It is from the amount of destruction and killing that this thing of as many people out and make life unbearable for those left behind, so that they leave in the period after the war. And therefore, we need to really see this war as a direct continuation of 1948, rather than of any of Israel's other wars of magnitude of what is happening. And the 12,000 number is just the number of those killed who were maimed beyond. There are even more thousands who are buried beneath the rubble. The amount of destruction to property and institutions, the destruction of all of the university buildings in Gaza, the destruction of schools, and the targeting and the militarization of hospitals as legitimate targets for the Israeli army is all part of a scheme to make Gaza uninhabitable. And as we've always seen, what the Israelis failed to achieve during the war, they try to achieve after the end of the war, after the ceasefire. And therefore, it's incumbent on those on the outside to start thinking about supporting life in Gaza after its destruction during this war, supporting those who are left alive to remain and to rebuild their lives, their shattered lives, and to support those who have been critically wounded, and there are now over 23,000, of whom 9,000 are children. Help them get the kind of medical treatment that they need and the rehabilitation that will help them at some stage rebuild their lives. The amount of social destruction, the number of orphan children, the number of families that have been wiped off the map is on such a grand scale that we're witnessing a reshaping and a redrawing of Palestinian society within Gaza, where a lot of kids are now being looked after by neighbors because they are the sole survivors of their families. Today I had an elderly couple who are looking after their grandchildren because their 3 children have all been killed, and they are left with 4 grandchildren to raise as from scratch, and these are toddlers between 4 and 6. And so that level of genocidal destruction is not without purpose. And the purpose for that genocidal destruction will continue after the war, which is to basically empty Gaza of its inhabitants. And if that happens in Gaza, then transfer of Palestinians in the West Bank and the transfer of Palestinians in what is known as the Arab Triangle is just a few years away. And that is why these conversations need to be happening now about rebuilding the lives of people in Gaza, including health, education. All institutions are now, have not been destroyed, but are uninhabitable. That level of destruction will continue until the ceasefire. But once the ceasefire happens, we need to be ready to rebuild these lives, because the period after the ceasefire will be as vicious and as genocidal as the war itself, because the aim for the Zionist project is to empty this land of its people. And this war lies within the core of the Zionist project's aim to empty Palestine. The amount of suffering that is going on is beyond anybody's belief. When Save the Children says that more children have been killed in Gaza than have been killed in the whole of the world since 2019, it gives you an idea how this war has been waged particularly viciously on Palestinian children. The number of Palestinian children who will need a lifetime of reconstructive surgery, a lifetime of mental health support, is at this moment, if there's a ceasefire right now, around 8,000. And children, when they are injured, would require repeated surgeries as their bodies try to outgrow the scars and the injuries that they have. And so the burden on the Palestinian health sector, the burden on the Palestinian medical institutions for capacity in terms of magnitude, it's beyond its capacity in terms of complexity and requirement. We need to hold on to this anger, this indignation that we have as we witness the trauma that our parents and our grandparents went through in 48 being played out yet again, but with the viciousness of the 21st century's war machine. We need to hold on to that anger so that once we are able to reach out to people who have been left alive in Gaza, once this genocidal war is over, we can ensure that this project that aims at the end of the day at removing the native population of this land from this land is not successful. Because once they're done with Gaza, they will move to the West Bank, and they will move to the Galilee, and they will move to Beersheba, and they will continue on this project. This is not an ideological, theoretical project. We see it and witness it in front of our eyes every 5 minutes. When you go to the emergency department at Shifa Hospital, you understand what the academics who describe the logic of the relationship between the settler and the native as being built on the logic of elimination. You understand what elimination of the native by the colonial settler means in flesh, in blood, in screaming, in tears. Is what's happening now, and it will continue to happen. Those working in development and economy, we all have to have this genocidal war is finished. Their genocidal intent at removing the native population of this land from their country does not come to fruition. The world as it is sees the level of carnage that is going on at the moment. And the reality is much, much worse. The stories of lives that are torn by this war machine, the stories of human beings who are tested beyond what we could possibly imagine is what is tolerable in terms of cruelty. All of this puts in a moral imperative on the rest of us to stand by the survivors of this genocidal war once this war is over. Unfortunately, at the moment, there's very little that can be done. The world has as one last attempt at wiping out the Palestinians in this patch of land. But that will not be the end of it once the ceasefire is declared. What happens, a second wave of that war happens, and that's when we need to know exactly what we need to be doing. And each and every one of us in their own sphere needs to be ready.
It is absolutely necessary that now these conversations and these plans are made. The destruction is almost complete in every sector of Palestinian life. Anything that can sustain Palestinian life on this land is being destroyed. In terms of infrastructure, in terms of education, in terms of health, in terms of housing. And so, as I keep reiterating, the Israelis always try to get what they could not achieve in war after the ceasefire. And that's why we need to now be having conversations after the ceasefire. What do we do to keep people in health? Because the aim of this war is to kill as many as they can, but also to make sure that life is intolerable for those who are left at the end of the war. And that's what we need to be thinking about, ensuring does not happen. How do we make sure that we rebuild we help people rebuild their shattered lives, and we help them get the necessary, for the wounded to get the necessary health care to help them rebuild their broken bodies. Because this is a war that aims at wiping them out, either physically or geographically.